Hello and welcome to this new section on adapting to changing payment models in this course, Mastering Revenue Cycle Management. So, in this section, we will help you get some good view of how to adapt to changing payment models in healthcare industry to implement RCM excellence in your organization. And in this particular lecture, we will talk about what are these value-based care models and how can you embrace them, right? So what do you think? How can you adapt to the changing payment models in healthcare industry? Any thoughts? So there are two things that you need to do to adapt to changing payment models in healthcare industry. First is to clearly embrace, welcome these value-based care models. Because as the healthcare industry shifts from fee for service to value based care, you need to adjust your RCM practices to align with the new payment models. Now, this might include bundled payments, shared savings, or outcome based reimbursements. Second thing you need to do is to implement alternate payment structures, right? Adapt your billing and RCM processes to handle the complexity of alternate payment models. Now, these models are accountable care organization, ACOs, or bundled payments. And there you need to ensure smooth revenue capture in evolving healthcare markets. So that's broadly the two things. Let's take a look at each of these, starting with how to embrace value based care models. So how do you think you can do that? Before we look at how can you do that, let's understand that adapting your RCM practices to align with the new payment models, like what we have been talking about, value-based care, bundle models, or ACOs, requires you as healthcare providers to refine your approach to billing, right? Data tracking and patient management. So all three, you need to refine your approach. You have an approach, you need to modify that to suit these new payment models. Now, how can you do that? How can you align RCM practices with these evolving payment models? Let's take a look at what are the things here you need to do. First is to understand the requirement of each payment model. Then how can you do that? So you need to familiarize your team with the guidelines of different payment models, such as Medicare's bundle payment requirements or shared saving requirements in ACO. So research model-specific guidelines. Then you need to analyze financial implications by reviewing how each model affects the revenue stream. Say, value-based models emphasize quality outcomes and patient satisfaction, impacting payment incentives. And third thing will be to determine the quality and performance metrics that influence reimbursement in each model, like readmission rates, patient outcomes, or preventive care benchmarks. So, like this, you need to identify the key metrics and incentives. So, next would be to invest in analytics and reporting tools to track quality metrics. And how can you do that? There are few things that can do. First is to focus on quality and outcome based KPIs. Now there you can use analytical tools to track metrics critical for new payment models such as patient satisfaction, readmission rates, and length of stay. Second thing would be to implement predictive analytics for risk stratification, segmenting the risk by level of risk and stratifying them. Their predictive analytics can help identify high risk patients, and that can enable proactive management to reduce cost and improve outcomes. And the third and last thing this that we can talk here is real-time reporting, where you can set up dashboards and reports for real-time tracking of performance on quality metrics, enabling timely adjustments in your approach to improve outcomes and maximize reimbursements. So that's how you can invest in analytics and reporting tools to track quality metrics. Next would be to adopt the advanced population health management tools, PHM tools. Now, there what you can do is to use PHM tools to identify management patient populations by chronic conditions, utilization history, and preventive care needs. Use PHM data to enhance coordination between primary care specialists and post-acute providers, ensuring that the patients receive continuous care aligned with the value-based reimbursement. Bridge clinical data with RCM data to gain insights into financial impact of care decisions and to align with the value-based goals. So that's how you can adapt the advanced population health management tools. Then redesign your billing processes for bundle payment and episodes of care. And for that, three steps. Define the episodes of care billing protocol. Develop standardized protocols for billing by episode of care, covering services delivered across multiple departments and providers. Bundle charges across care phases. Consolidate charges into single billing statement of for episodes of care such as surgical procedures, rehabilitation, follow-up visits to comply with the bundle payment agreements and coordinate with the partner providers by ensuring billing and revenue sharing with partner providers with aligning with the bundle payment terms, promoting transparency and accurate reimbursement. So that's what you need to do in redesigning billing processes for bundle payments and episodes of care. Develop data sharing capabilities, create interoperable systems, invest in systems that support seamless data exchange between providers and payers, helping streamline the claim process under value-based models. Engage in collaborative payer relationship by working with payers to establish clear guidelines on data sharing expectations, as well as quality and efficiency standards required for reimbursement, and utilize secure data sharing. Ensure compliance with privacy regulations like HIPAA by using secure data sharing methods to protect patient information across different stakeholders. Next would be to enhance patient engagement and education in this whole use of value-based models. And there you need to educate patients on treatment plans, care expectations, and health goals, as their involvement is often a key performance indicator in value-based models. Provide patients with financial counseling on out-of-pocket costs, especially if their plans has high deductible elements or if a bundle payment model applies to their care. Give patients upfront cost estimates and use historical data to help them anticipate any additional costs they may incur based on their specific treatment needs. So enhance patient engagement and education in this manner. Create a multidisciplinary team to oversee value-based RCM adjustment. And there are three things you can do there. Involve clinical, financial, and RCM staff by forming a team to oversee the transition to value-based RCM, because this will help align operational and financial goals and address interdisciplinary needs. Train staff on new payment model requirements, obviously. Regularly train staff on the specific requirement of the new payment models, including metrics for quality, patient experience, and clinical outcomes, and ensure alignment on shared goals. Make sure all departments, with including clinical, financial, and RCM, share the common goals of enhancing patient outcomes and optimizing reimbursements under the new model. Redefine denial management process for the new model. You would have a process for that. So redefine that. Analyze denial trends related to new models. Look for common denial causes that may be tied to specific payment models like inadequate quality documentation, and adjust workflows to minimize these denials. Enhance documentation for value-based care by ensuring that clinical documentation supports the quality metrics essential for reimbursement, as insufficient documentation can lead to claim denials under value-based models. And coordinate with quality and compliance team by collaborating with compliance teams to ensure RCM process fully adhere to the new model requirements, mitigating denials and ensuring payments aligned with the regulatory expectations. So that's how you can redefine the denial management processes for these new models. Implement continuous monitoring and adjustment by where you need to monitor financial outcomes against benchmarks by regularly tracking revenue against predefined benchmarks, analyzing financial impact of new models, use data to identify improvement areas by continuously using analytics to find gaps between expected and actual outcomes, making adjustments to billing practices, documentation, and patient engagement as needed, and engage in continuous education. There, you need to stay informed on the latest updates to payment models as CMS and payers often adjust guidelines based on the policy changes or healthcare trends. So, implement continuous monitoring and adjustment like that. Lastly, establish a feedback loop for continuous improvement. Collect feedback from clinicians and RCM staff by regularly taking feedback on process effectiveness that can help identify challenges and make continuous improvement. Regularly assess impact on patient care and outcomes. There, you need to align performance feedback on patient care with value-based payment requirements to ensure efforts benefit patient satisfaction and outcome, because that's the ultimate objective, right? And adapt processes based on payer feedback by leveraging payer feedback on claims and compliance, adjust billing and documentation processes, and improve reimbursement consistently. So, by aligning RCM with new payment models, that requires aligning these RCM practices with new payment models needs a flexible approach that integrates data analytics, enhanced billing practices, and strong collaboration between clinical, financial, and administrative teams. By focusing on continuous improvement and clear communication, you as healthcare provider can adapt your RCM processes to optimize financial performance under evolving payment models. So what do we do next? After looking at how to embrace value-based care model, we will take a look at now how to implement these APM structures, alternate payment structures, right? So thank you so much for watching this first lecture on adapting to changing payment models in this course, Master in Revenue Cycle Management. I hope you're continuing to learn new things, continuing to enjoy. And I do look forward to see you again in the next lecture. Please feel free to message me if you have any questions. I'll be happy to answer your questions, and do download the PDF file to take a look at anything that you need to.